Hey, I'm Dr. Stuart Rammell. I'm an interventional pain management doctor at Pinnacle Pain and Spine. Today I want to take some time to talk about sacroiliac joint-mediated pain. Now, the sacroiliac joint is the joint that is formed in the lowest part of the spine where the pelvis meets the sacrum. This right here is the sacrum, and then the iliac bone, which is one of the three bones of the pelvis, connects to that and forms this sacroiliac joint. Now, that joint can become irritated, inflamed, and degenerated and can cause pain. It's actually one of the more common sources of low back pain in patients. The literature has reported it as being up to 20% of patients with low back pain have a component of sacroiliac joint-mediated pain going on. The most common presenting symptoms for sacroiliac joint-mediated pain are patients who have low back and buttock pain that will often radiate down into the buttock and sometimes into the back of the thigh, radiate out to the side of the hip, and then sometimes radiate into the groin, and less frequency will have referred pain all the way down to the calf. These patients complain of increased pain in the buttock, either on one side or both sides if both sacroiliac joints are involved, and then pain with prolonged standing, prolonged sitting, and especially going from a seated to a standing position. Now, sacroiliac joint-mediated pain is something that, similar to other causes of low back pain, is something that we would initially treat conservatively, treating it with activity modification, over-the-counter analgesics or pain medications, and then with potentially physical therapy. Now, if those modalities don't give patients adequate relief, there are some interventional pain procedures that we can consider, and I'd like to take a minute to talk about three of those different procedures today. The first is a sacroiliac joint injection, or a sacroiliac steroid joint injection to be specific. The way that this is placed is under live x-ray or fluoroscopy, very similar to other injections that we do in the spine, where we place the patient on their belly, line the sacroiliac joint up with a live x-ray, place a small spinal needle into the space through the skin, place a little bit of contrast dye in that space, watch it spread to know that we're in the correct spot, and then instill local anesthetic along with the potent anti-inflammatory or steroid medication, and then the needle comes out. Very short procedure, very minimally invasive, and it can provide patients with months of relief potentially, and probably more importantly, it allows the pain to decrease and allows the patients to better participate in different physical modalities, which will allow them to rehabilitate their pain. It's also a good diagnostic measure in order to see that that's where the pain is generated. It's actually been the only thing that has been shown to be specific for sacroiliac joint dysfunction is block using local anesthetic. So that's something good that we can find if we do that procedure. Now, there's also the potential to do a radiofrequency ablation procedure of the small or the nerves that bring sensation back from the sacroiliac joint. This is a similar procedure to radiofrequency ablations that we do in the low back, mid back, and cervical spine, but these are the small nerves that bring sensation back from the sacroiliac joint. The way the procedure is performed is again under the x-ray or live fluoroscopy, where we place the needles down onto the areas of the bone where those nerves typically run. We'll test those nerves to make sure that we're only stimulating the sensory nerves for that joint, and then using radiofrequency electricity, we will ablate those nerves. Everything comes out, nothing's left in the body for that, and it can provide patients with prolonged relief, and then again allow them to better rehabilitate that using other physical modalities. Now, the third thing that I want to speak about is actually a procedure that's becoming more and more common in the interventional pain management community, and that is a minimally invasive sacroiliac joint fusion or sacroiliac joint fixation using a small cortical graft or using donor tissue graft. This is a model right here of what the graft actually looks like. The outside is made out of cortical bone, and then there are small openings where demineralized bone matrix is placed. The way that this procedure is done is also in a surgical suite or a fluoroscopy suite under some light sedation. There's a small, about 1-inch incision that's made in the buttock, and then the instrumentation is passed down under the live x-ray to access the joint. The joint is accessed, opened up, and this small implant is placed in that area and then left in place when all the other instrumentation comes out. The 1-inch incision is closed with sutures, and patients go through, of course, routine wound care. Now, with this in place, it causes initial fixation and stabilization of the joint, and then over time, fusion of the joint. Now, one of the common reasons that patients will develop sacroiliac joint dysfunction are if they have had fusion of the lower part of the lumbar spine, because what happens is that load that was normally carried where the spine is fused gets displaced onto the sacroiliac joints and causes increased strain. Now, people will ask, oh, if I do a fixation procedure of the sacroiliac joint, won't that displace the load onto other parts of the body? And actually, that's not the case with sacroiliac joint fusion. Different cadaveric mechanical studies have shown that it doesn't displace the load onto separate segments, similar to what happens to the sacroiliac joint when the lower part of the spine is fused. Now, this is a procedure that definitely isn't like a first step for sacroiliac joint mediated pain, but in folks who have had sacroiliac joint injections and have had good relief, improvement in function, but have it be for a short duration of time, then they would potentially be good candidates to have this procedure. One, it's a minimally invasive procedure. There is a short recovery period. Generally, patients are able to quickly go back to their normal activities of daily living, and very little tissue destruction for the procedure, just a small 1-inch incision. So this is something that could potentially be very helpful for patients, and it's something that's being offered more and more by interventional pain doctors. So the point of my talk was to discuss sacroiliac joint mediated pain as a possible cause of low back pain. So like I said, it's a common thing, and there are interventional treatments that we have available to offer our patients. So if this is something that you've had done before, and you've done well with the sacroiliac joint injections, but they've been short-lived, there are potentially other procedures that we could consider, so come in and see me and we'll talk about it. If this is something that we're already talking about, I look forward to seeing you in the surgical suite or in the fluoroscopy room for the procedure, and hopefully we can get you feeling better. If this is something that you haven't had done, but you continue to have low back pain, you know, it might be coming from the sacroiliac joint, so I'd love to see you in my clinic, and we can discuss sacroiliac joint mediated pain as a possibility for causing your low back pain and some of the interventional procedural options that we have for that. So I look forward to seeing you, and hopefully we can get you feeling better and get you back to doing the things you enjoy.